If you're dealing with hair thinning, especially male pattern baldness, then you've probably heard about finasteride. Oral finasteride has been a standard treatment for decades, but it comes with a few complications you might not expect. Today we're breaking down what finasteride does, how it works, and why oral and topical applications matter. And most importantly, whether it's going to save that hairline. Before we dive into the topical version, here's the core mechanism. Finasteride is a drug that inhibits 5-alpha reductase, the enzyme that converts testosterone into dihydrotestosterone, better known as DHT, the androgen that drives follicle miniaturization and pattern hair loss. Too much DHT around hair follicles and the follicles shrink, your hair falls out, and you see visible hair loss. What finasteride does is lower DHT, which stops or slows down the miniaturization process, which can promote hair regrowth. The topical version targets the same mechanism, but right where it matters most, the scalp. So that's gonna be the biggest difference between oral or topical. And we're gonna get into more details on which one's better for you in just a second. First, let's talk about the oral finasteride. Oral finasteride works systemically. It goes into your bloodstream and reduces DHT everywhere in the body. That's effective, but also where some of the complications come from. Systemic exposure can lead to side effects for some people. Now, let's go on to the topical finasteride. It's designed instead to be applied directly to the scalp, ideally to keeping most of the action local and keeping limited absorption to the blood. Don't just take my word for it. Here's what the research shows us. Topical finasteride significantly improves hair count compared with the placebo, with effects numerically similar to oral finasteride. With topical, the reduction of DHT is not as severe as oral, so it reduces your side effects. Users often combine it with minoxidil, which can improve blood flow and scalp signaling without needing more pills. Now, why would people combine minoxidil with finasteride? A lot of people try topical treatments assuming that if you just apply a treatment to the scalp, then their hair will grow back. That can work, but only if you're addressing the actual drivers of hair loss, which is more complex than just skin deep. Hair shedding and thinning have at least two major issues. Hair shedding and thinning actually has two major issues I want you to think about. The first one is a hormonal issue, which is the DHT suppressing the hair follicle growth. Second is the blood flow or nutrient delivery to the hair follicle's microenvironment. Minoxidil, which is often paired with finasteride, isn't a DHT blocker. It improves blood flow, which helps promote your hair staying in the growth phase. Topical finasteride blocks DHT where it matters, on the scalp. But combined approaches, the internal and external signaling, gives you a better, healthier hair follicle environment and covers the hormones, which will give you better results together. That's why you see so many hair loss regimens combining minoxidil, finasteride, and lifestyle changes. So now let's cover some realistic expectations and when to give up. So what can topical finasteride realistically do? It can improve your hair count, reduce the DHT on your scalp, all with less side effects than oral. But it's not a magic bullet. Not all topicals are equally effective because the formulation matters. It still depends on the follicle health and the timing. Some people will still get systemic absorption. Additionally, the blood flow and follicle signaling piece can't be ignored. Hair follicles need nutrients, oxygen, proper signaling pathways with DHT under control to thrive. If you're losing your hair and you're thinking about trying finasteride, just wait to hear about the potential side effects. Now let's go over the biggest questions about finasteride. Is it safe? And what are the potential side effects? Now, if you're looking into finasteride, I'm sure you've heard about the potential sexual side effects. So let's talk about them. Libido, difficulty maintaining an erection or achieving one, decreased sexual sensitivity. Although these effects can happen, they're only reported by about 2 to 4% of users. The second potential side effect are mood and cognitive changes. So although there can be side effects, let's go over some important context. Not everyone experiences these side effects. Only about 2 to 7% overall experience any side effects. One other piece of context is the side effects are dose dependent and individually specific. Many of the effects resolve after discontinuation. This doesn't mean that everyone will experience this, but what it does mean, you should approach finasteride like any topical medication. Talk to a dermatologist or a specialist. Be wary of off-labeled products that aren't well studied. If you're frustrated with hair loss and considering topical finasteride, here's the best approach. First, get a professional evaluation. Dermatologists can assess how far your hair loss has progressed and determine whether a combined approach or just finasteride is right for you. Second, think holistically. Topical DHT blockage is just one piece of the puzzle. Follicle signaling, blood flow, inflammation, lifestyle, they all matter. Third, be realistic with your results and consistency. Topicals require daily consistency and application, but most treatments take several months to show a significant change. And most importantly, treat the follicle environment, not just the surface. Topical finasteride, it is a powerful tool, especially when you understand how it actually works, and combine it with thoughtful, evidence-based care. If this clarified something for you, drop a like, subscribe, and let me know in the comments. Are you using topical finasteride? If you want to stop guessing and make informed decision, LifeRX is here for you. Click the link below and book a consultation today.